Welcome everyone to Patient Voices Across Europe podcast. In this series, we speak with members of ELPA SLD working group. This is a dynamic team of advocates from across Europe committed to raising awareness and driving change around steatotic fatty liver disease, also known as MASLD. In each episode, we bring you local insights, patient perspectives, and solutions from the ground up. Our guests are not just ELPA members. They are change makers working within their communities to shift policies, fight stigma, and empower patients. So thank you very much for tuning in. And today I am extremely happy to welcome in our podcast Miss Yianoulla Koulla from Cyprus. Yianoulla, how are you? Welcome to Brussels.
Thank you very much. Good morning. First of all, I would like to say that it's really an honor and a pleasure to be here because as ELPA, you give us a voice to all these patients associations across Europe to speak about our problems, our visions, our barriers and obstacles that we have it daily in our as a group, as a patient organization. Thank you.
So one more time, thank you for joining us. Your organization is working and focusing on increasing the awareness about liver health and also access to care in your country. This is an important topic for you. And you are also focused on prevention, early diagnosis, and systemic change. Is that correct?
Correct. We have a lot of work to do since Cyprus Liver Patient Organization, Promitheas, this is our name in Cyprus.
Yes, tell us a little bit more about your association and your team.
You. Well, it's a very dynamic group. The board members are all very active, and we need to do because we have all kinds of liver diseases. I mean, we represent all liver patients. From cancer to transplants, virus hepatitis, fatty liver and metabolic dysfunction. So we have a lot of things to do. It's really, we have every month an activity to address the problems, and we're trying to find solutions to advocate patients. But we are very happy to do it and very enthusiastic because, we help people. We advocate people. We give them a voice like you did now. Exactly.
And I was saying in ELPA, patients talk to patients in a different way. So I think that we both share this statement that patient national associations are extremely important, and they are important toolbox in this healthcare system and how to support patients on a daily basis and also their families and really help them build this supportive system that they need on a daily basis. Yianoulla, what are some of your yearly, the biggest activities, or maybe an activity that you would like to use this podcast to share and to share your success, and what are you doing in your country?
Okay, as I have mentioned before, we are doing a lot of activities. But I will start with the viral hepatitis, since next month we have the Worldwide Hepatitis Day. We have a very interesting activity. We were co-organizers with the WHO. There is an office in Cyprus, and with the WHO of Europe. We have many speakers from abroad, and the government, they were there. We talk about our problems and what to do about it. We also have a survey about alcohol consumption among the youth, and it was really, really surprising, the results of this survey, because in Cyprus is a small country, family oriented, and we were very surprised to see to find out that young people aged 12 to 15 they have alcohol consumption because they want to be part of their friends, of their friendships, they think it's more cool, and etc. And it was really, really shocking, the results of this survey. Another great moment for us, it was what we have achieved in Strasbourg. Me, as a president of Promitheas, I am a member of the National Committee for Transplants and Donations. Mm-hmm. And we had a great success because we managed to bring all the activities for the next year in Cyprus. And this is great because, we do not have the facilities for transplant center in Cyprus. And these patients, we send them abroad to have a transplant, and government pays lots of money for it, and I feel that something could be done. Also, I'd like to mention that we do a lot of activities for fatty liver and metabolic dysfunction. You see, in Cyprus we have even more higher prevalence than in Europe because of the childhood obesity. So in Europe it's something in 1 in 4 of the EU population. In Cyprus it's 1 in 3. So we do have a problem, and we are working a lot to lift this problem, to see what we're going to do.
Yianoulla, you are the leader of ELPA SLD working group, so I would like to touch on that because it's an important role. It's challenging sometimes. You are managing a lot of members from different countries, from different cultures. Yeah. So tell me a little bit about that experience. How are you handling all of that?
First of all, we have one thing common. We need to do something about this increasing, alarming situation with the fatty liver and the metabolic dysfunction. This thing connects us, and they are all wonderful. Actually, they have such a zeal and enthusiasm, and they want to do things. And we have association from France, from Spain, from Slovenia, from Finland, Denmark, Israel. We are a very, very big group actually, and because of this situation, the alarming increasing of this disease, and we're trying to stop it, to intercept this progression. Because if we do not do something about it, we're going to have a pandemic with this disease.
Exactly, a strong statement. Today, just for the audience to know, we are organizing a high-level policy event exactly on this topic. And this is, I know, a passionate topic for you. So tell us a little bit more about this. You call it pandemic. Tell us a little bit more about that.
Well, it's really, we have to reveal what this disease is exactly about. And it's not just a health issue. It's also a financial issue. Underdiagnosed liver disease leads to low productivity, ballooning healthcare cost, and lower quality of life. So what we want is to stop the progression, to intercept this progression, to help prevent this generation from carrying this burden. And it's time for action, it's time for decisions. We need to do something about it. Otherwise, it will cost. First of all, it will be a burden for families, for patients, and then it will be a financial burden for each country. We have to do something.
Do you have some example of your activities in your country, how you are fighting this issue, maybe with policy makers, decision makers in your country? Do you have some good practice that we can all learn from?
Yeah. What we were trying to do in Cyprus is to make it more Cyprus problem. It's not just numbers of patients or the families who got affected by this disease, but it's a bigger problem. It's you see this disease gone from liver issue to a major public health crisis, and this we're trying to show that we will find it sooner or later. We have to do something about it, because it will be epidemic, and we have to unmask the real face of this disease. And it's not on, as I said before, it's not affecting only patients. It's affecting the whole country.
Another strong statement.
No, it's true, because if you will see the statistics, I mean, we see Spain. This disease leads Spain having the highest number of transplants. Pay a lot of millions of euros for this. I mean, if you see France, 8% of patients with fatty liver have transplant. In Denmark, the liver transplant far exceeds the heart or the lung transplant. So it's not just a health issue, it's also an economical.
It's spreading to different fields on a national level, and it is already a problem of a country, as you stated. So I couldn't agree more. Who are your biggest supporters in Cyprus? Where do you seek this, network, this strength also from other communities, maybe also for other patient national associations to learn from your practice?
Okay, we try to involve, first of all the stakeholders, because it's something which involves everyone. So we involve the politicians. Why not? They are concerned, they have a lot of concerns about their citizens. So we involve state politicians, we involve healthcare, we involve patients, we involve nurses, we involve everybody to help us a bit in this effort.
But I think this is the way to go, right? We need, as you said, everyone, and together we are stronger. As we have this slogan of ELPA, I think we all can relate to that. Maybe, Yianoulla, one additional question. Where do you struggle the most as association? What kind of support do you need? More people to help you, or do you need more? I don't know. What is the biggest struggle for you on a daily basis?
Okay, what we're trying to do now is to implement what they call the non-invasive liver test in primary care. It's very important to support, to motivate, to help primary care physicians to understand the benefits of screening in their daily practice. Screening is prevention. It can detect the onset of the disease, and prevention is everything when it comes to fatty liver and metabolic dysfunction. So we're trying to include, to educate primary care doctors to use tools. You know, there are simple tools like the liver screening test that you could detect, assess the high-risk group, and then you can go further investigation. There are tools that you can use to assess fatty liver and metabolic dysfunction. So we try more to this.
But as you said, the numbers are rising, right? So I guess there we have some sort of obstacle. We have some sort maybe lack of communication. You mentioned primary care doctors. Do you think we are lacking there something? How to really dive deep into prevention and to diagnose earlier?
Yeah, we have. This is our biggest issue, the screening. I think it's there is a gap in screening. That's why we're going to have this high level today. We need national strategies, national action plan, and the EU level coordination to help us implement, let's say, the targeted screening protocols in primary care. And I think you see, it's not just to interception with this way the progression of the disease. It's also cost effective. But above all, Veronica, we have healthier EU citizens.
Again, strong statement. You're making it very easy for me to ask you questions. But Yianoulla, we are actually at the end of our session. So I will just give you the floor for like any final statement. You are one of our very passionate advocate. You are active. You are constantly pushing for changes. So what are some statements? Last statement from you to our audience.
Well, I could speak for hours, but I don't want to. But I will say one sentence. Mm-hmm. We need to prevent the preventable. And this disease is preventable. So let's focus on this.
Thank you very much, Yianoulla. Thank you for your time. I'm really looking forward to today's high-level policy event. I think it will be powerful. So if anyone, if you want to follow us, of course, follow ELPA profile, social media campaigns. We will be updating you about the results there. Thank you very much for tuning in and enjoy the rest of your day and see you soon.
Thank you.